Well, I think the turning point wasn't really in the school days, but more in medical school. But no, like, by studying medicine and trying to relate on how we can practice medical science and be a doctor, it struck me that a lot of things that doctors do does not make sense unless you understand the science behind it. After all, treating patients has to be evidence-based, has to be logical. If you get the disease wrong, you understand it wrongly, your treatment of the disease will be wrong. So it struck me very early, at least to me it was pretty early, by 4th year as a medical student. I realized that I wanted to be a pathologist, which means that I want to look at the basis of disease. And a lot of understanding of basis of disease means you search for the knowledge behind it. And that really put me onto the path for research. So doing pathology made it the easy path, the foundation path for research to be done. So it really started, right from medical school. I suppose my teachers, because, basically young people would be inspired by the people they listen to. So in medical school, it was, the teachers in pathology, because they were very succinct in explaining disease. That was the inspiring part. But in terms of childhood inspiration, I would say that my parents were the inspiring people, because they always do not hold back the fact that if I were to ask questions, they would try to answer, or if they don't have the answers, they encourage me to read. And right from young, I already developed a fairly inquiring mind. And actually my first experiment, if it's of any interest to you, was with my brother. We decided to build a rocket to send a grasshopper in outer space. What we call outer space was just shooting up in the air and over the house. And we were just quite fascinated about the concept of energy and power and how things drive. And of course, my family wasn't rich. We put all our pocket money together and bought a few things, gunpowder and all that stuff. And we created our own little rocket, and we had no astronauts, so we caught a grasshopper and put it inside and shot it right over the house and came back on the other side. And the grasshopper was well and alive and ran off back to the bush. And it was quite exciting, at least for me. It was, I was only about 8 years old. That was a pretty exciting experiment.
Research.
Well, I think breast cancer research has come a long way. There are many players in the field now. Although I was probably one of the earlier researchers, my early research was really more related to my work as a pathologist, because I wanted to make sure that the understanding of the scientific basis of cancer was well grounded, and that pathologists, when they diagnose breast cancer, would be as accurate as they can be. So a lot of my early focus on breast cancer research was related to making sure that we don't mistake conditions that may mimic breast cancer but not breast cancer, do not get misdiagnosed. And breast cancers are also then not mistaken the other way around for benign tumors when they are actually malignant tumors. So it's the early research that I did was really more related to improving diagnostic accuracy, developing techniques to make sure that diagnosis was proper, training people to make sure that they do it correctly, and so on. But since then, we've gone beyond that. We're talking about understanding breast cancer in terms of what drives the disease, what makes the breast cancer progress, because as it progresses, it becomes different from the original cancer. It acquires new mutations and becomes less amenable to the original treatment. And as most people understand innately, that the more advanced the cancer is, the more resistant it is to original therapy, and that's because of new mutations that arise. So you see, today, a lot of breast cancer is now focused on understanding the cancer progression. I have my part in this. I look at a specific type of breast cancer known as the triple negative disease. It may sound like a big word, but basically it's a disease that right from the beginning is negative for at least 3 very important markers that will help the clinician or the oncologist decide what treatment to give, what treatment to give the cancer. But I'm trying to understand this disease better. But there are others that are working at different angles of the disease, looking at the mutations that help pick out the cancers that may have a hereditary basis so that we can target women who are at risk, at higher risk than normal. There are others who are looking at growth factors, because in the end, developing treatments that block the growth factors can also help to prevent the disease from progressing and so on. So we've come quite a long way in that there are many groups working on it now. There are also many collaborative efforts in breast cancer. So there are cancer research collaborating with the USA, with Europe, with Australia, and I think it's come quite far compared to the early days when Well, I think ethics is very fundamental. I know years ago, people thought that science justifies itself, that the search for knowledge justifies everything we do. But actually, it is not true. Because we were first and foremost human beings, and human beings have to have a conscience and human values. And scientists should not forget that. They are firstly humans, and the science that they do should benefit mankind. You do not benefit mankind if what you do is unethical, because then you promote bad practices, practices that exploit other people. And that does not justify science. To me, that's not good science. And I chair the medical ethics committee in my institution. And University Malay is a fairly active research institution and a very active medical treatment institution as well, because in the Faculty of Medicine we have our own teaching hospital. So chairing the ethics committee makes me realize the importance of ensuring that research is done follows at least the Helsinki guidelines, on how the Declaration of Helsinki guidelines on how research should be practiced. And also many young researchers that come up to put up their research proposals are very well-meaning. They actually want to do research well, but they do not appreciate a lot of the fundamental issues, or some even side issues of what can go wrong in research. And that brought me into the area of training. It is important to inculcate good principles in them. That's why I then put a lot of effort into workshops, into good clinical practice workshops, into writing workshops, research methodology workshops. And the process, when they learn how to do research, they also at the same time learn how to do research with good research integrity, with good ethics involved. And I think only then researchers can be respected. Oh, I think we are, at the level where we can lead. The fact that they elected me to be the co-chair for the Inter-Academy Medical Panel representing the low and middle income countries means that they think Malaysia is able to provide that leadership, and we are able to appreciate the gaps in the low middle income countries, and yet appreciate what may be achievable compared to the more developed countries. And I think we are exactly at that kind of crossroads, and we are probably ready to move up. There's, of course, a lot of work to be done in many low and middle income countries. But Malaysia, I think, has bridged the gaps in many areas. We still have some deficiencies, but we are in the place where we can provide the leadership for the rest. Well, my hopes for the young researchers is, to follow your passion. The problem with research sometimes is that authorities like deans and vice chancellors push young people to do research because they say, well, if you don't have papers, you don't get promoted. That may be one way of promoting research, but the really best way to promote research is to have a passion for it, to follow what really you're curious about. What is the area that you really hits you and you really want to know the answers? You go and research into that area, rather than there are grants here, there's plenty of money there, so you jump into the bandwagon and then you do what everybody's doing, running around and all doing the same old thing. And you're actually not particularly interested, but you're doing because everyone is doing. Fashion. I think fashion has its own purpose, but fashion should be recognized for what it is. Really good research comes from good passion in what you do. If you really want it, you like it, it drives you. The long hours you spend doing the research just passes like that. You don't feel the burden of it because you love it, you like doing it. So that is my advice very often to young people. Follow your heart, and you'll find that it's easy.